Hi, are you Rosemary?
Yes, I am.
Hi, my name's Katie. I'm a student nurse that's been paired with you today.
Oh, okay.
Can you give me a report on your patient?
Yeah, sure. Patient in room 619, Glenn Light. He's a 67-year-old male, weighs 171 pounds. He's got no known allergies, full code, no isolation. He came in today with a stage 2 pressure ulcer on the right heel. It was about 5.5 centimeters by 2.5 centimeters with 3 centimeters deep. Also has diabetes type 2 for the last 20 years. He was initially admitted from the MD's office. He came into the doctor's office complaining of a high glucose for the last 5 days and ranging at about the 300s. He normally is standardly around 120. He also indicated that he had a non-healing wound on the right heel for the last 3 weeks. His pain currently is at a level 1. He's alert and oriented ×3. His gait is steady. There's no visible distress. His pupils are equal, round, and reactive to the light. His lungs are clear to auscultation. His breathing is unlabored. His there was a S1 and S2 with no murmurs, regular rate. With regular heart rate and rhythm. His pulses were palpable on the radial and dorsal pedius, and no edema or clubbing or cyanosis. His muscle strength in all extremities. His abdominal was fat, symmetrical, and soft. His bowel sounds were present in all 4 quadrants with no ascites, and there's no bruit in presence. He did go to the bathroom with assistance. Urinated yellow clear. It was about 320 milliliters. And his last, most recent vital signs were temperature was 98.4, heart rate was 80, O2 stats were 95, and his blood pressure was 145/72, respiration 18. He does have a peripheral IV on the right medium vein, which is the forearm. He is set up to be administered IV medication of morphine, 4 milligrams every 4 hours. The physician wants us to basically control his glucose levels, teach him on his diabetic management and pain management, and we also want to evaluate his wound at this time. Presently he's got a partial thickness dermis, shallow open ulcer, and its intact fluid is filled with blister. His last labs initially came in with a glucose level of 310. It's currently at a 290. His sodium level is 149. Appears to be normal. His potassium is at 3.8. It is it's on the low end, but it's still in the normal range. His BUN is at 19, and creatinine is 1, which is both normal. His white blood counts are at 5,000. Hemoglobin is 14.5. His hemocrat was 41.2. It was slightly low, but it's expected for his age. And we are going to be, he's actually due for his litho right now, and so if you want, we can go ahead and administer.
Okay, great. Can you tell me why specifically the client is receiving this medication?
Yep, he's taking the medication to lower his glucose level.
What action does the medication have on the body?
It inhibits the production of the insulin, so that we can get his glucose level in control.
Okay. And when should you question administering this medication?
Basically, we want to have signs that make sure that he's not hypoglycemic, to make sure his blood sugar levels are not too low, and we're just going to look out for those signs and symptoms.
Does the medication have a therapeutic serum level?
Yep, we want to just check his potassium levels and just keep an eye on that and make sure that they're not falling lower than they should be.
Which vital signs must be monitored?
We want to check his heart rate because one of the things with hypoglycemia is that tachycardia, and just keep an eye on his respiration and everything like that.
What physiological parameters should be monitored when the medication is being administered?
Again, just checking his heart rate, lung sounds, just keeping an eye and make sure that there are no signs as far as the hypoglycemia side effects.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital and at home?
You want to make sure that this medication needs to be given before his meals, so he needs to make sure that he's eaten prior to taking the medication. You also want to make sure that he is testing his glucose level to ensure that he is getting the appropriate units that he needs. You want to educate him on how to administer the medication and how to dispose of the needles as well. And also for the signs and symptoms of hypoglycemia.
What are the side effects of the medication?
The major adverse effect would be the hypoglycemia, which is going to be basically tingling in the hands and feet. It's tachycardia. Those are going to be the main things you want to keep an eye out for.
And how will you know if the medication was effective?
His glucose level should get into a more controlled level.
Okay, thank you so much for answering my question.
Of course. All right, let's go ahead and get his medication.
Okay.
Hi, Mr. Light. I'm here to administer your medication.
Hello.
Hi. I'm going to be giving you your Lispro. I know you've been dealing with your diabetes for the last 20 years, so you're familiar with how Lispro works?
Mm-hmm.
Can you tell me a little bit about what you do know?
Just that it controls my glucose.
Okay, perfect. All right, so let's go ahead and, I did see that you wanted some education on your diabetic diet.
Yeah, that would be good.
I will go ahead and give you that information. I can give you some material and you can read it over, and if you have any questions, you just let me know.
Okay, that's perfect. Thank you.
Did you eat your dinner?
I did.
Alright.
Yeah.
I did see that your meal was ordered. Just wanted to verify that.
Yeah, I was okay.
Can you just tell me what your name and date of birth is?
Glen Light, 8/16/49.
Perfect. So you want to just make sure that you're verifying the patient's name and date of birth from their on their band, and then you're also just going to confirm that we have the right dose, the right amount, the right time, and the right route for this patient. And we're also going to verify that the amount on your meds are matching with what's in your MAR. So in this case, we are going to be administering 6 units for this patient. So as according to the sliding scale, he is glucose levels at 290, which is indicating that it should be the 6 units. Sorry about that. Can you just give me your name and date of birth? I gotta...
Glen Light, 8/16/49.
Sorry about that.
That's okay.
Technical difficulties. So again, you just want to verify that you have the right amounts, the right medication, and that you're comparing it against your MAR. And you're going to want to clean the top of your medication with an alcohol swab. Fill it with air.
Can you tell me why specifically does the client receive this medication?
And then you're gonna, once you fill it with air, you're gonna go ahead and fill up the number of units that you need, which is 6 units.
When should you question administering the medication?
Make sure that you're using the one hand cap to recap your needle when you're not using it.
And does the medication have a therapeutic serum level?
Now, did you have somewhere in particular that you wanted to have this?
We can do my right abdomen.
Okay, did you have it at a different location earlier?
Yeah, we did the left earlier.
Perfect. So what we're going to do is we're going to clean the site. And again, just make sure that you have everything correct. And you're just going to feel a pinch. Okay. Then you'll want to just sign your order and save it. Okay. Okay, and here's your actual education information I was telling you
Oh,
about.
thank you.
Did you have any other questions for me?
Nope, none right now.
Do you need any other information you might need right now?
Oh no, this is wonderful.
Okay. So let's just make sure that your call light is next. Okay, you got your call light. If you need anything, just let me know.
Will do. Thank you guys.
Perfect.
Were there any pertinent pieces of information you reviewed before administering the drug?
Yeah, we wanted to make sure that we took his glucose and ensure that we were administering the right amount of units based on the sliding scale that was there in the orders.
Did this information affect your decision to administer the med?
It did just because, again, if his glucose levels were within the normal range, we would not have administered the medication.
Okay. Thank you so much for answering my questions.
Of course. Have a good one.
You too.
Good luck with nursing school.
Thank you.